Hello, it's Graham Crawshaw here, and I'm today going to bring you the latest update on some benchmarking around COVID-19 that CASME has been doing over the last couple of weeks. This specifically is talking about HR procurement and what our members have been telling us is impacting that particular category strategy. We've had over 55 responses from across the CASME membership reporting and updating into this survey. So let me tell you some of the findings that we've been able to put together. So specifically on HR procurement, and we asked whether category managers, procurement was involved in the crisis management organization that was been put together by so many organizations in response to responding to the virus. And it's good to see that over 50% of organizations responded that they've been providing strategic input to this, this crisis organization. So many have set up a specific team to support the activities that have been going on, and it's great to see that procurement is a stakeholder in that team. So what companies have been doing is a combination of responding to concerns over cost, but also looking after suppliers. So we've seen examples where signing authorities for contracts have been raised to tighten that process up. We've also seen CFOs demanding greater control on expenditure. And then we've also seen examples where procurement has been centralizing the sourcing of emergency materials. So if I then go on to look at travel and expense purchasing cards, because these are being used to simplify the process for employees to support their procurement and their organizations. What we've seen is 19% of members said there's a complete travel ban, and that if any essential travel is required, then the approval process has been escalated and increased. 10% of members said that they've been able to use equipment from the office for use at home. And 16% responded that using purchasing cards to expense equipment to help them working at home. And there's a broader range of what is considered as permissible purchases. Finally, 7% said that they've now been able to arrange it so that purchases made via catalogue can now be delivered direct to an employee's home. And so we have also seen that systems have been modified so that greater number of procurement contracts can be approved online. So if we look at the spend impacts that have been taking place during the crisis, and we asked for a range of areas around HR procurement, what impact has there been? How extent has the impact been sort of significant or less significant? You could see from the graphs here that recruitment, contingent labor and relocation are seen as areas where costs will be significantly reduced, and that spend on payroll services will be least affected, which really isn't sort of too much of a surprise. The large reduction is those items shown in the light blue. If we look at where procurement is assisting the HR category, then again, you can see from the chart the difference where procurement is being asked to provide that extra support, and that's shown in the purple color. So procurement's most likely to be asked in taking cost out or helping to manage spend on temporary recruitment, contingent labor, followed closely by learning and development. So in summary, rather than cost reduction, some companies are focusing more on the assurance of supply and the criticality of supply. We asked about mental health and recognize that that's something that many companies are providing support to their employees. So for example, 33% of respondents said that they are referencing mental health sessions, sites or apps. Others, 16%, are reminding employees about assistance programs, and 14% have been actively adding in some social events to bring employees together. The majority is saying that HR clearly is very busy and not looking to amend contracts just at this point. And so we've had feedback that the approach being taken is a focus on paying for services that have been delivered, recognizing if they've not been delivered, then there will be no payment. Medical benefits are being adjusted to cope with payments covering COVID-19, so that's testing and treatment. And I think for HR procurement and also for many categories, the general consensus is we're still in a firefighting mode. So in May and June, still responding to the short-term needs of the business. But by the time we get to August, that will be the point that category strategies will be reviewed and looked at for the next sort of 12 to 18 months. So that's a summary as reported by CASME members. Look out for our other videos based on other categories. Until then, stay safe.